Now, let's look at this amazing image and check if we are looking at the right or left humerus bone. We see here an epicondyle. This is much bigger than this. Consequently, this is the medial epicondyle of the humerus. We see here a fossa. Consequently, this is the posterior aspect of the humerus. And then we can identify that this is the right humerus bone. Now, if we look at the bones in the forearm, we see the radius bone, which is always lateral, and we see the ulna bone, which is always medial. Obviously, the ulna bone is in the same side as the medial epicondyle, and the radius bone is in the same side as the lateral epicondyle. This part of the ulna is called olecranon. Oh, I hit my olecranon. Guys, you hit your elbow. The olecranon is the anatomical name for elbow. So this is the olecranon of the ulna. Obviously, the olecranon process of the ulna will articulate with the olecranon fossa of the humerus bone. When we play the video, we can see the ulna from a medial view. And when we look at the ulna bone from a medial view, we can identify that this is the olecranon process, which will articulate with the olecranon fossa of the humerus. We have this U of the ulna. The U of the ulna will articulate with the trochlea of the humerus bone. And that's why this U is called trochlear notch of the ulna. This part right here of the ulna bone is called coronoid process. And the coronoid process of the ulna articulates with the coronoid fossa of the humerus when we flex at the elbow. So we bring the forearm closer to the arm. And I will show you a video with a flexion movement soon. If we go ahead and we keep looking at this image, we can stop in the anterior view and we can see right here the coronoid process of the ulna that when we flex will go into this fossa right here of the humerus bone, which is called coronoid fossa. So remember we mentioned the trochlea of the humerus. This is the trochlea of the humerus. The trochlea of the humerus will articulate with the trochlear notch of the ulna, which is the inside of the U of ulna. When we look at the radius bone, we see here the head of the radius bone. And the head of the radius articulates with the capitulum of the humerus. So this is the capitulum of the humerus. Remember, you capture the signal for the radio to work. You tune in. So this is the capitulum articulating with the head of the radius. Now, when we bring the forearm closer to the arm because we are flexing, the same way that the coronoid process of the ulna goes into the coronoid fossa of the humerus, the radius head, the head of the radius, goes into the radial fossa of the humerus. And again, I will show you a video with that happening soon. Now, can you notice that the radius head articulates with the ulna bone right there? And since this part of the ulna bone is touched by the head of the radius, this part of the ulna bone is called radial notch of the ulna. It is a notch in the ulna bone that receives the head of the radius. Also, looking at this view, we can see very well that we have a rough spot in the ulna bone, and this rough spot is a tuberosity. Since this is a tuberosity in the ulna bone, we call this ulnar tuberosity. Now, when we look in this view, we can see that the radius bone has a rough spot right there. And obviously, if it is a rough spot, it is a tuberosity. If it is a tuberosity in the radius bone, this is called radial tuberosity. The radial tuberosity is very important because it is the point of attachment for the biceps brachii muscle. And let's take a look at that right now. In this video, we are seeing the biceps brachii muscle. We see that it attaches at the radial tuberosity of the radius bone right there. And this movement that brings the forearm closer to the arm is flexion. And when we take the forearm away from the arm, that's extension. So this is flexion, and now we have extension. Flexion and extension. Now let's take a look at how the bones are articulating when we have our forearm in a flexed position. Now, obviously, you guys will need to imagine that we do not have all this connective tissue right here between the bones, which are there to show how it really is, because we need all this connective tissue to stabilize the joint. Now, we are just learning at this moment the bones and bone features, so that's what we'll be focusing right now. And keeping that in mind, we can see that every time we flex our forearm, we have the coronoid process of the ulna bone going into the coronoid fossa of the humerus bone. And the head of the radius bone goes into the radial fossa of the humerus bone. Now, observe that the inside of the U of the ulna, which is named trochlear notch, independently of us flexing the forearm or extending the forearm, which is the opposite movement of flexion, this trochlear notch of the ulna is always articulating with the trochlea of the humerus bone. And also, the head of the radius is always articulating with the capitulum of the humerus bone. Now, when we are flexing, this is the olecranon, remember? When we are flexing, the olecranon is not into the olecranon fossa because we removed the olecranon process from there and we brought the coronoid process and the radius head close to the coronoid fossa of the humerus and to the radial fossa of the humerus, respectively. Now, there is one more thing I would like you guys to notice, and it is this tendon right here. This is the tendon of the long head of the biceps brachii, and this tendon is going through the intertubercular groove or bicipital groove of the humerus bone.